Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. We have Dr. Williams and Dr. Yaffe here today, so I'll turn it over to them for some brief remarks.
Okay, good afternoon everyone, and today we'll start off with updates from Dr. Yaffe. So I'm going to hand things over to Dr. Yaffe for the numbers and updates.
Okay, thanks very much. Since we last spoke on Thursday, Ontario has reported an additional 7,131 cases of COVID-19, with Friday and Saturday reporting over 1,800 cases each day, record highs for the province. The numbers declined only slightly yesterday and today, with over 1,700 cases reported each day. Our 7-day average rests at 1,570, and this is up from 1,429 1 week ago. The majority of our cases reported since Thursday, approximately 86% of them, are concentrated in those regions that are now in the red or lockdown zones or levels. When broken down even further, approximately 57% of the cases since Thursday are in the regions of Toronto and Peel. When we look back on the month of November, Ontario's average for daily cases was 1,359, the highest monthly average since the pandemic began. The second highest was in October, with a monthly average of 775 cases per day. In terms of testing, in the last 4 days, we have processed an average of 51,622 tests per day, with an average positivity rate of 3.9%. Today, there are 618 people in hospital, with 168 of them in ICU. That is up from 507 people in hospital and 156 people in the ICU a week ago. Tragically, since last Thursday, we have seen another 81 people lose their lives to COVID-19, and we want to offer our sincere condolences to everyone impacted. I'll turn it over to Dr. Williams now.
So these trends, of course, remain concerning. The fact we've had record high numbers on Friday and continued high numbers over the weekend and today is troubling. The number of tests are up, which is one way. It's good that people are coming forward and getting tested. It means a lot more people are being exposed. And of course, when you're having daily rates in the upper 1800s and this last couple of days in the 1700s, that's far more than we've had in previous weeks. So as we said at our modeling presentation on Thursday, the word that was used by Dr. Brown was precarious, and we are at that level of where we're holding around that 1,800 number. And the question is, will we be able to keep it there and come down, or will we plateau and then start going up again? And with these days of more activity out and around, we're seeing people taking sometimes more and more leniency around the distancing, the masking, and not staying home. Even when they're out and around, some are not actually going out to get tasks done. They're just socializing, which is what we do not want to have and do not want to see, especially in our areas of Toronto and Peel. And of course, we're into our second week of after having announced our lockdown and numbers. We've changed some again on effective as of midnight this morning. And so we've had a few changes from some greens going to yellow, yellows going to orange, and one orange going to red. And those numbers continue to be concerning in that direction. We've also seen that some of the ones in the lockdowns are holding at the moment, but they're still going up, as Toronto was up again today, and we hope that they will bring that number back down again shortly. So we're hoping that by putting these measures in, we're trying to reduce people's need to go out and around and to watch their activities, maintain their distancing, their masking out in public spaces, but mostly decrease the amount of time they're out in large congregate social settings in the public venue. And we're hoping to look at that and deal with those issues as we go forward, and seeing how that behavior is changing as we move into the so-called post-Thanksgiving into the more pre-Christmas season, pre-Hanukkah season, and seeing how people's behaviors will be tempered and go into a COVID-type normal behavior, still doing as we put out in the holiday guidelines that we did issue, and they're out in the health units and on the website for those in the green, yellow, orange, red, and the lockdown zones there, and to adhere to those while still trying to have and work at having a proper and a good festive season as best you can in a COVID reality at this time. We're also aware that some businesses are having difficulty maintaining those measures. Some have been visited by enforcement and told to reduce on that number, and so that will continue to happen as we seek to curtail the spread among our people, because a lot of those individuals are out there. Some are actually in their incubation period and are shedding, even though they felt it was fine. And we get people still in some social gatherings where they said, I didn't think anyone was sick. I found out later they were, and they were surprised to find that. Then they find that they were sick and they're in other groups and they were shedding it too during that time. So people really have to be consistent and adhering to the distancing. Stay home if you're sick. Get tested if you need to be tested. Wait for your results before taking any more direction from public health and ask them for those ideas there. Minimize your outings. Keep household family gatherings only, especially if you're in the lockdown and red zone. And to limit your outdoor activities and make sure you plan those ahead of time. There's a lot you can do from online. There's a lot you can do, as you know, in those areas between delivery, home delivery, or curbside pickup. And that includes not only retail issues, but also restaurants and food services accordingly. So we really need everybody to really focus down now. And that means not only those that are in those settings, also keeping your watch out for those that are in the school cohorts with parents and children, and those that are in the post-secondary school situations and entities as you're into this intense time of preparation and getting those essays in and getting those projects completed, and sometimes take-home exams and different ones that you might be doing. Because if you're going to prepare to do that time when you're coming back if you're going to return home, you need to really do that intense period of that 2 weeks beforehand, really cutting down any of your social contacts and being very vigilant about your exposure totally, so that you could go back and connect with the family at that time. So we're asking you to put all those things in place now, because tomorrow is the 1st of December. You have to start thinking and planning ahead, not only on your activities, on your shopping and purchasing and other things you might be doing and you need to do about essential issues that have to be handled. So planning ahead of time can protect you, protect your family, your friends, and your loved ones by doing it properly, doing it again, and doing it consistently. But you need to plan ahead. You need to think ahead and do that in that regard. So those are the comments I have at the moment. And with that, we'll open up for questions from the media.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Randy Rath at CHCH TV. Please go ahead.
Hi, doctors. Last week, the CDC put out a report where they said that there could be up to 8 times the number of people in society in the States that have COVID, but they're unaware of it because they have no symptoms or very light symptoms and they didn't bother to get tested. Do you have a similar estimate for Ontario?
Just so we're clear, you said 8 times the current number, or?
Yeah.
Okay. You want to try it first? I have an answer, but.
Oh, you go ahead then.
Okay. I think the aspect around the asymptomatic transmission in there, as we have done testing on different groups, we are aware that some people are, as you say, when they're incubating, are starting to transmit. When is the peak transmission time? Usually it's just before they become symptomatic. And of course, the timing of that is difficult to catch the person at that moment. Estimates around that are based on some projections and numbers. I'm not sure I would agree definitively that it's 8 times. I think that there are, as we've seen, a certain percentage that are positive when we do contact tracing and we do some connections on people, and that they do find that out. We find some people we test are negative, and then after 4 or 5 days become positive after they develop some symptoms at that time. So I haven't had, I've heard estimates and different, I would say, epidemiologists and people doing studies and projections put out a number like that. I've heard various numbers at different times. Not a definitive one unless you do population large surveys and you identify a group in that percent that might be there, if it is indicative of the whole population. I don't know, Dr. Yaffe, you want to add anything further to that?
Sure. I would say, like, I'm not aware of a number like that for Ontario, but when the province has done serology tests to look at antibodies, how many people have antibodies indicating that they have been exposed? The last survey I'm aware of showed about 1% of the population. It might be a bit higher now. And we know that some people will not have any symptoms or they're pre-symptomatic, as Dr. Williams said. I would assume that in areas where there's a lot of COVID, where the positivity rates are higher for those tested, there are probably more asymptomatic people walking around as well. So that's why we recommend everybody do the precautions, because you can't assume just because you have no symptoms that you're not infected. You're infectious to others. You may not become ill at all, or you may have such mild symptoms you're not even aware of them. So that's why everybody has to do the same precautions regardless of symptoms.
Follow-up?
Yeah, I'm wondering about the numbers of people in ICUs with COVID. Are we getting close to the point, or have we reached the point where other surgeries are being postponed or canceled?
So when that question was asked last week with the modelers, with Dr. Brown, as you know, we moved from the 150 to the 200, and noting that once you get over the 150 in our ICU levels, because our hospitals are already at well over, on the average, 95% occupancy with other, cases that require ICU admission. And so remember, those 160, 168 that are in there now represent only a small proportion of all the ICU beds that are in the system, but those are not empty. They're being utilized for other purposes. When you start to see that number climb, as Dr. Brown alluded to, and we have seen that also the case, then some hospitals that are above that number, and when their ICU is taken up with more beds for COVID patients, then elective surgeries or surgeries and procedures that would require, say, a few days, 1 or 2 days in ICU, will have to be deferred or canceled. And we're starting to see that in a few of the cases now, especially in Peel and some parts of Toronto. So as Dr. Brown said, and we knew that from our data before, once you go above that 150, because it's not uniform across the province, that means some areas of the province are being subjected even more and are starting to lose that ICU capacity, and will have to cancel and defer some surgeries in order to maintain the adequate number to have access for COVID patients.
Next question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Rob?
Hi, doctors. I'm just wondering what you think of the numbers of cases they found when they did the asymptomatic testing at Thorncliffe Park Public School, 18 students and 1 teacher, and what you think that means about where this is in the community.
I'll start. Dr. Williams may want to add. Those numbers are obviously concerning. We know that is one of the neighborhoods in the city of Toronto that has a high rate of COVID transmission. I believe their positivity rate is around 16% in the community. And so that is why that is one of the schools that was chosen for this testing initiative. And when we have a lot of COVID in the community, by its nature, it spills into the schools. So it's not surprising to find cases in the school. And unfortunately, sometimes that causes a small outbreak. We've been very fortunate that outbreaks have been pretty small in schools and well controlled due to all the layers of protection. I believe that, and we're working very closely with Toronto Public Health on what measures should be done, need to be done to reduce the transmission, to reduce the infection rate in schools, and keep them as safe as possible. So it's concerning, but it's not surprising. As I said before, when you have more infection, more cases, it's not unexpected you would get more asymptomatic infection as well.
Follow-up?
Yeah, I'd like to, thanks for that, Doctor. I'd like to just switch gears a little bit to the new category in the daily stats where they list cases by outbreak setting. So we see lots, a fair number for bars, restaurants, recreational fitness, retail. But the numbers for personal service seems very low at 1. So that's, hair salons, barbershops, nail salons, I would imagine. Can you shed any more light on that number? Do you think you're just not tracing enough outbreaks in those places, or are they really that low risk? And if so, why are they still closed?
So you've answered one is that right now in the lockdown zones, they are closed. So they obviously will not be showing any cases of outbreaks at this time. In there, as you recall, when we had some investigations before, the example we always quote, the one they had in Kingston, it was picked up indirectly by someone else because people are in there for a short period and leave, and some were not taking a lot of recording of the information and clients coming and going. So we continue to monitor that, and the chance of that, find that person that was, because they won't be symptomatic when they leave the place, it's later when they report back, and often you find some people say, oh, I went there and here and there and there and there. It's very hard to allocate it right back. I think it shows you the amount of intense investigation that Kingston had to undergo to identify all the ones that are attached to that setting and ask people to record back. So that was an intense amount of work over a period of 2 to 3 weeks to identify that. So just because we haven't identified a lot, it doesn't mean they can't be a source, but then you're going to have to get your spreading person in that setting, especially if it's one of the staffers who is not taking proper protocols and procedures in there at that time. So we're hoping that some of the measures in the ones that are not in lockdown are maintaining the proper distancing and different activities there with precautions, etc., and facial coverings to handle that. We're not saying we'd like to have outbreaks. We don't want outbreaks in those places. We'll continue to watch and monitor that, but it's not always that easy to nail it down to one specific site at that time without a lot of investigation.
Last question, unless anyone else joins the queue.
From Mike Crawley at CBC News. Please go ahead.
Mike?
Please unmute, Mike.
Sorry about that.
Premier Ford mentioned in his news conference this afternoon that the health table is looking at ways of strengthening protections of residents in long-term care. I wonder, Dr. Williams or Dr. Yaffe, if you could mention what some of those would be, what kind of measures are under consideration right now to tighten things up in long-term care.
Dr. Yaffe?
I'll start. Yes, there's a very concerted focus on long-term care. Obviously, it's a very vulnerable, high-risk population, and we've had a significant increase in outbreaks and illness and death in this population. So through the Ministry of Long-Term Care, they have begun weekly testing of the staff instead of every 2 weeks in collaboration with Ontario Health. We have reduced the ability to visit for general visitors in zones that are red or gray. In terms of they are certainly allowed to have the essential caregiver, but not general visitors. We are trying to reduce the number of people in a room, those ward rooms that have 3 or 4 people in them. We want no more than 2 if possible. Improved infection prevention and control. We have developed what's called the hub and spoke model, where certain identified hospitals, or in the north, some public health units, are providing infection prevention and control expertise on the ground to long-term care facilities that are having issues. And there's an incident management system table that I sit on that goes through in quite a lot of detail the homes that are experiencing outbreaks. Do we need to have an order to have a hospital go in and take over? And in some instances that has been required. There are efforts as well to increase staffing, a number of different strategies around that, because that is one of the issues as well, to ensure adequate staffing as well as infection prevention and control. So there are more measures being implemented, and we're closely monitoring and evaluating as we go along.
Follow up, and this is the last question.
Actually, I didn't have a follow-up, that's all.
Thanks, everyone.